Hello, I am here with Dr. Steve Herber, our hospital CEO. And Steve, thank you so much for being here and being willing to answer some questions. I know that several people may have a lot of questions about what's going on and about the coronavirus, otherwise known as COVID-19. So can I?
I'm happy to be here and thank you for asking me. This is kind of an unusual time, and to give accurate information to our church family and anybody else watching is really important.
Well, I have a couple questions that I've prepared for you, and so I'm just going to go ahead and start with our questions here. What can you tell us about the efforts in our county concerning the COVID-19?
Well, both hospitals in the county are getting a lot of information from the county Health and Human Services on a daily basis.
Okay.
As of our last communication last night, we don't have any known cases originating in the county, but we are very prepared. What's being talked about is where we might have drive-in stations. You know that they've been doing testing in other places where there are a lot more cases, where somebody could drive up in their car, have the swab done, so they're kind of isolated and they're contained. Then they go home and wait for those results. And in California so far, that takes a couple of days to get the results because of where we're having to send the test to. So there is a setup being done in the south end of the valley, and we're talking to the county about doing something similar in the north end of the valley. That has not been set up yet, but we have a lot of arrangements made. Many of us get Nixle alerts, and so we saw that the county declared a state of emergency.
Right.
That just makes more resources available. So it's a preparedness thing.
So once there's a state of emergency, that means that the hospital has more access to resources. So if anything does happen, then we are prepared.
Exactly.
Oh, okay, well, and that's very encouraging. You said a couple days. What does a couple days mean? 2 days, 3 days?
So about 48 hours. So we have currently at the hospital, well, let you ask the next question. so thank you for giving me the test ahead of time, so I'm ready with the answers.
No, and that's okay. Like, I want this to be fluid, you know, right? We want to know, what is St. Helena Hospital doing to, are you prepared to take someone that may have it? And what does that look like?
So we certainly have the partnership with public health and the county, but we have all the readiness that's already been done with our own resources, and we haven't waited for them for anything. The thing that has happened in this country that we've seen in areas where it started to be more of an outbreak is the testing was a rate limiting step. Who could do the testing, having the kits, how long it was taken. So comparing us with Korea, for example, where they've tested hundreds of thousands of people, we're limiting that to people who are really symptomatic and likely to have it. We may find that a lot of people had the virus and never were sick enough to even know about it or seek out testing. But just to answer your question, St. Helena Hospital is ready and prepared. We have
I saw the signs that you had out there.
They're not very welcoming. They say, stop, in Spanish and English, and they say, read this, and if you feel like you're ill, we have set up a little testing station outside the emergency department. So staff will come out, meet patients who, and I'll talk about what are the criteria that make us suspicious, so we test. But we're keeping the sick, possibly infected patients away from people who are seeking other kinds of care. It's essential that we keep a hospital open for what a community routinely needs. You know, broken bones, you know, big cuts and bruises. We need to care for that, but we want to do it in a safe way. So the patients that might be infected, we have a way to do their swab, and if we think they need hospitalization, they will safely be taken to an isolation room, and we have the reverse flow and everything. People may not know, but our top floor of one of the wings is a 12-bed intensive care unit, which is bigger than most hospitals in the area. Even the brand new Sutter Hospital in Santa Rosa, we have more capability. So we receive patients with respiratory problems from all over Northern California.
Oh, wow, I didn't know that.
So we are very prepared, and we have had patients that we have successfully shown do not have the virus, but they have serious respiratory illness. And so we're not just testing people anymore that may have traveled. It's more about what are the symptoms and could it be
Is it
related?
possible?
Is it
So
possible?
if it's possible, we want to make sure that we test.
Exactly.
Just to be safe.
Yes.
And so if I'm thinking about, because they're saying that the coronavirus is very similar to the cold and to the flu, and so I may get the cold and the flu, but then be worried that it's the coronavirus. How do I tell the difference between the cold, the flu?
Yeah.
and-
So that's a great question. So we're in the season where people may get a cold or a
Yeah.
flu. Usually, what we think of as the flu is aches and pains, and there are flu bugs that affect more the GI tract and have a certain kind of symptoms. Most of them are upper respiratory, so you have the runny, stuffy nose, the things that we think about for the common cold. Coronavirus is different. It is a lower respiratory, so it will cause a pneumonia. So there's a lot more cough with it. There are shortness of breath. You may have the achiness, but the
runny nose, would you have the runny nose?
not as much. This is something that goes to the lungs, and this is where the serious illness has happened. And so I have the guidelines that we provided for all of our doctors in the clinics that I'm responsible for here in the Upper Valley, and this is available to all physicians through County Health Department in the state of California. But I wanted to just share with those watching this, what will a doctor tell them? So if you're thinking about calling in, and in fact, we had some PUC students calling the hospitals, well, should I get tested? I'm feeling this way or that way. So this is what a doctor will consider in deciding whether to test. So symptoms of acute respiratory infection, such as fever, new cough, shortness of breath, that's a new onset, and maybe achiness, but not sick enough to require hospitalization, that may be an indication for testing. The ones that definitely will be recommendations, a population that's a higher risk.
So these are symptoms that a doctor would look
Right.
for in order to decide if they're going to do the
That
testing.
we should do the testing. And
Okay.
then I want people to know what the testing involves, just because
Okay.
there's not a lot of clarity about that.
Okay.
So the same thing I just talked about, but in a population we're more worried about. So that's 65 and older, because they seem to be at higher risk.
Okay.
As we mature, our lung function isn't as robust. So something that's going to go into the lungs could have more serious implications. So these are patients that have the fever, the shortness of breath, the cough, and some signs of pneumonia. We want to make sure it's not coronavirus related, so we will be testing them. And most of those patients are going to be hospitalized. We have 2 right now that we're waiting for test results.
Okay.
I'm not very suspicious they have coronavirus, because this time of year we have older adults that may have some lung disease, they may have smoked in the past or something, but they will get a pneumonia, and we're going to treat that effectively.
Okay.
But we just want to make sure that they don't have coronavirus, because we'll take extra precautions.
Right.
So that doesn't infect our healthcare workers or other patients. So let's see, that's the main thing. Patients are requiring hospitalization with or without travel, because we now know in this country that people who may have brought it back from their travels have shared it with others, and so
Right.
it doesn't mean that you need to have traveled
Right.
to possibly be infected.
And
so,
how, can you tell me a little bit about how it spreads? I know this is a little off
Yes.
script, but
no, that's important.
because I think that way we're sanitizing everything.
Yes.
I am constantly, doing my hands because my nose itches more now that I'm not supposed
Yes.
to touch my face.
Exactly. So that's an important question, Josie, because at first, when we didn't know, we were treating it as if it could be airborne. And just recently, I think as recently as yesterday, there was some dispute between the state of California and CDPH.
What's
and
CDPH?
California Department of Public Health.
Okay.
And the CDC.
Okay.
Our national organization that's expert on infectious disease. But now they believe that it's spread by droplets. And so that's if somebody sneezes or coughs and there's fluid that might have virus in it. That's why keeping a social distance, it could be on people's hands, so not so we'll do the coronavirus. welcome. You know, those things that we don't even think about. You know, we're a loving congregation. We
Yeah.
hug each other.
Yeah.
We wanna kind of rethink that and be a little safer, but we don't think it's spread by airborne, but now droplets. So that's why a mask isn't so important unless you're
Unless you have it.
testing somebody or somebody that you think you might create droplets. So I wanted to talk about the testing for a second. So think of a Q-tip, but kind of a longer Q-tip
Okay.
with a longer tail.
Okay.
And what a nurse or doctor will do is just slide that through the nostril so it can meet the back of the throat. The back of the throat goes up higher, and that's where we're likely to find the virus. It's not painful, but it's not comfortable, and it might provoke a cough or a sneeze. So the person performing this should have
A mask.
protective eyewear, you know, goggles or something, a mask, and gloves. But that's all they need to be safe. And then, so they're gonna do that on both nostrils.
Okay.
And then they slide it into a special liquid in a test tube,
Okay.
and that's what gets sent off, and the test is run. Currently, because of the testing locations and the volume of tests, that's why it can take 2 days to get the results.
Right.
In a week or two, we have some testing that we do on site for what might be serious infections, and we get the answer in 2 to 4 hours, and we're gonna have that for coronavirus also on this campus. We just don't have the little cassettes developed yet by the company, so that's coming to St Helena Hospital very soon. But right now, we're sending it to a testing place, and we get the results in about 48 hours.
Are you hoping to have that up in the next month or
Yes.
before that, or?
As soon as it's available, we're gonna be offering it on site, so we have the answer quicker.
Yeah, hey,
Yeah.
well, that's exciting to hear. It's exciting to hear that all of this is happening before we have ever really even identified that there is any transmission that has happened in our county. I know I want to get back to our questions as well. We talked about some unique traits that we need to look for, but
Yes.
we don't have transmission in our county. Can you talk a little bit about why it's important to minimize social gatherings?
Yes.
You said a little bit of something about, you know, we don't want to be hugging in church and because of the droplets, but why are we minimizing our interactions
Yes.
with people?
So this virus, we were planning to talk about it a little bit. It originated in animals, and we've seen this virus mutate before and make it over to people.
Okay.
And so a couple of examples of that are SARS and MERS, which
Okay.
were never really became prevalent in this country, but
Mhm.
they were in Asia and the Middle East, and they are very deadly. So they are based on coronavirus. There are also 4 examples of coronavirus that just cause a mild cold. So when it mutates, it isn't always that deadly, but this mutation is one that is first more contagious.
Mhm.
So if you think of how in cold and flu season, one person having the flu might share it with one other person.
Mhm.
So we know through some months it'll get around. This is, with COVID-19, it's 4 times as likely to
Oh.
spread, or one person will spread to 4 people. So
Okay.
you can see how if we're gathering
Gathering.
in sporting events or bigger venues,
Mhm.
and somebody who may be completely asymptomatic, but they are contagious, there's gonna be a lot of spread, and that's what we see in Italy.
Right.
So if you compare Italy with Korea, where they just really said, hey, stay at home, there's been a lot less spread. I think China did the same thing, and now they're kind of recovering. The cases are going down, but they really took a hard stand. So that's why I think in this country, we're taking the extraordinary steps of canceling sporting events, and schools are having kids stay home.
Yeah.
This is just so we don't see this spread, because if we didn't do something like that, we could have a surge in cases that would overwhelm our ability to care for the patients. And that's what's happened in Italy. They don't have enough resources in the hospital to care for all the people who have pneumonia. And and people are dying because they can't do that. If we're able to contain this and keep up with those who really do get sick and treat them successfully, we'll have a lot less bad outcomes. And so that's really what we're collectively trying to do. And so far we're hopeful, but it's only a matter of time till it pops up in Napa County. And what we'd like to do, instead of getting hundreds and hundreds of cases because somebody was going around from Trader Joe's to Whole Foods to Costco, and a lot of people got the virus, we're trying to minimize that. Also, when we do go out or we're touching things, I mean, little things that I didn't think of. My wife gave me, I can tell she loves me, she gave me a little packet of these gloves, and she says, use that when you fill the car with gas. I wouldn't have thought of that, but how many people a day are touching that, you know, handle to fill their car with gas? So if we just are thoughtful about protecting ourselves from picking up the virus and then exposing ourselves and others, potlucks are a great example.
Okay.
I wouldn't have thought about that, but you know, a relative of mine who's in pastoral ministry says, hey, those are perfect places where we're potentially sharing a lot of germs. I went to our cafeteria and said, whoa, we have people serving themselves, and it's great, I can get as much food as I want. Now we have dietary workers.
And they're
You say
serving
what you want, they're serving us, so
They have
we're not
gloves
all
on.
having to touch things. And
Right.
those are just simple precautions we can take, because the goal is really keeping, well, I need to keep our staff and our patients safe,
Right.
but protecting each other. So
Right.
that's what it's about.
Right. Going off of something that you said, so would you suggest maybe we wear like leather gloves or when we go out, and then should they be disposable? I think that they're all out of gloves, disposable gloves right now, but you know, should I go grab some cotton gloves and just put those on, and then when I get home take them off and wash them?
Well, you could do that. I think just kind of being aware and doing the precautions that we've all been reading about. So
Washing your hands.
COVID-19 is very susceptible to soap and water. And it's the soap and water combination that's important. So you don't just soap for 20 seconds and then rinse it off. Get your hands wet first, then the soap, and then, I don't know if you've noticed, but 20 seconds seems like an eternity when I'm washing my hands. So I'm just saying, it feels like a long time, but getting all the surfaces of your hands, and that is the most effective thing.
Okay.
When we're out and about, using at least 60% alcohol-based hand sanitizer would probably, and it has to be wet, so you can't put it on a paper towel and just do a little whisk. You need it on your hand, and do the same thing, cover all the surfaces. That is the best way to protect yourself. You know, we happen to have a box of gloves that at home, and so my wife was being extra protective, but that probably is adequate. But the other thing is we crave companionship and we want to get together. The CDC has talked about groups less than 10. That makes it less likely that you're going to have a big group go out and spread it. But what we've decided to do in the hospital is whenever a role can work virtually, we're going to be safest if we're not convening groups.
Yeah.
So we're trying to work remotely, not bring people into the hospital who might unknowingly expose their colleagues to the virus. So anything we can do to reduce the risk is smart.
Right. And I don't know if any of you have gotten emails. I know I got an email from my health system as well, just saying, if you get sick, if you're not feeling well, this is our link, and you can talk to your doctor online via Skype or some sort of face-to-face or over the phone. And so I am getting encouragement to make sure that I let my doctors know that I'm not feeling well virtually. What if, for whatever reason, I do believe that this is something that I have? Yeah. Could you tell me a little bit about what I would look for at home, and then what do I do next?
Yeah. Well, we talked about some of the symptoms, but there's just, with everything we hear on the news and read in the paper, it just is natural to be extra worried.
Right.
So I would say calling your healthcare provider, because they've got this script and they could actually work through that with you and either reassure you or say, you know, you're right, let's arrange for you to be tested. With our ambulatory clinics, you know, the initial reaction was, oh, if you think you're sick, don't come near me, just go to the ER. And that's not necessarily the right thing.
Yeah.
You have a relationship with your care provider in their office. So we provided a script to really help people work through this and then seek testing if that's appropriate, seek care if that's what you need. Most of us in this country who become exposed or even infected will not be sick enough to need hospitalization.
Okay.
So it is, again, it's more impactful on those who are older, who have some lung function issues, and so, you know, staying at home, you know, talking to your doctor virtually if you can, by FaceTime or whatever, or just on the phone. And then we're ready to do testing if that's needed, and we've set up a station to do that here, because we don't have big volumes of people yet, and we may do a drive-through thing so people who aren't sick enough to be in the hospital, but they really have the symptoms and they might get worse.
Yeah.
You know, because this normally people are exposed and about 5 days later they get the symptoms, and it can last up to a couple of weeks. So that's what we're aware of.
Can you talk a little bit about what a carrier is? Because I think that there is a little bit of question of how can you have it but not get it, and
Yeah. So carrier's probably not the right term, but
Okay.
there are those who are infected and maybe sharing the virus and don't even know it.
Okay.
So you can be contagious, which means other people could catch it from you when you don't even know you're sick yet. So that's an important thing, because you know, I think of my parents who are in their 80s, and I'm feeling fine, but I want to protect them. So, and I have to travel to see my parents. So I'm really mindful of, I don't want to unknowingly cause them harm. So that's just something to be aware of. Somebody could be infected. And so that's where this idea of self-quarantine. So I have some friends who traveled internationally, and they kind of stayed at home for a couple of weeks. And once they didn't have symptoms, then there have been people who got symptoms 2 weeks after their exposure, but that is very, very rare.
Okay.
So if you've kind of been home and figured out how to get groceries and stuff, and you don't feel, you're probably not gonna get sick, and it's safe to see people. But again, following this guidance of just not creating a situation where you could either catch it or give it or spread it, that's what we need to do as a community and a nation to really keep this thing from being such a prevalent problem, which even though Italy knew it was coming, but they didn't do all the things necessary to suppress the spread until, like yesterday, said, okay, we're not going to have these gathering places happen because they're a very social country, and people wanted to keep seeing their friends and stuff, but that caused harm.
Is there anything that I can do? I know this is, again, we're wanting to make sure that you guys are aware that the fact that we're not meeting isn't because we are already spreading it, but it is a preventative measure. Are there any other preventative measures that I can take at home, or even like boosting my immune system? Because we talk a lot about washing
Excellent
hands,
question.
but then how
so
do I
that's
make sure?
prevention, but also making ourselves healthier, because we do know that, you know, in a country that tested lots and lots of people, we know that there's over 50,000 people that are recovering from this. And there are people that haven't been tested that were just mildly ill, and so now they're kind of immune to it.
Okay.
So taking care of ourselves is really important. And so managing stress. Stress has an impact on our immune system and would make it harder to keep this at bay or keep the infection minimized. So some of the strategies there are, you know, do things that you enjoy. Practice some things that we've talked about in this church, meditation and mindfulness. There's some things that really calm you down.
Time
So-
in prayer,
exactly.
time in silence and listening to
Right.
God and reading scripture, yeah.
Right. Specific things that we can also do to boost our immune system is mild to moderate exercise, not overdoing it.
Mhm.
30 to 60 minutes a day is
So could I go
adequate.
running outside? Can I go for a jog?
Being outside, doing a hike, walking the dog. Really strenuous exercise isn't more helpful. Sometimes that lowers people's immunity, marathoners and stuff that are
Mhm.
more extreme. So just keep it in the mild
Mild
to
to
moderate. We live in a beautiful area. That's probably gonna reduce your stress and help your immune system here in the Napa Valley. You don't need to do a lot of supplements, but a healthy diet, kind of the Garden of Eden diet, Creation Health, Take 10 type diet,
Yeah.
Plant-based diet, that's gonna help optimize your body's immune function. Getting enough sleep is really important, 7 to 8 hours a night. For kids, it's probably more than that. But
Yeah.
making sure you're getting your rest is very helpful. And there's probably a couple others that you could tell me. But those are the main things that a person could do. You don't need to take a lot of supplements, the healthy diet and fresh air and exercise, managing your stress. Those are all good things.
Yeah. I know one thing that I was doing worship with kids at Foothills this week, and one of the things that I told them to do was to make sure that they find a way to make themselves laugh. In Scripture, in Proverbs, it says that laughter is just like medicine, and really when we whether it's watching something on Netflix or just getting on the phone with somebody, it is very helpful to remember that laughter actually creates endorphins. Is that right?
It gives your immune system a boost.
It gives your
You're
immune
exactly
system
right.
a boost, and so before we knew how this worked medically, Scripture said that laughter is just like medicine, and it's the best medicine that we can do, that we can have and we can take, because there's still joy in the midst of feeling like we're Christians in quarantine.
Yeah.
Is there anything else that we missed? I think we kind of covered some of the. I don't know if.
I
Something
bet
we
you will
missed.
get some questions
Okay.
from people viewing this,
Okay.
and then you and I can touch base, and we can post that on Facebook.
Oh,
Because
that's good. Okay.
we tried to be comprehensive. It was a great list of questions. Then we wandered around. We were having so much fun. We didn't follow the script. But I bet there's some questions out there, and I would be happy to work with you to provide the answers.
Okay.
And that would be a great follow-up if anybody watching this had other questions. But
Great.
this is changing daily, and
Yeah, that's true.
maybe on Facebook, as we get new information, we'll share it with you, Josie.
Oh,
and
that sounds great.
We can let our church family know.
So before we end, I just want to encourage you, if you do have some questions, why don't you go ahead and put those questions in the comment below this this video, and we will try and revisit those questions and get back to you again on some updates on this. And remember, God did not give us a spirit of fear, but God gives us the spirit of being able to overcome and of hope. And I just want to thank you for just being patient with us while we are working through this together. God bless you. Have a wonderful Sabbath day. Get some good rest. Have some good laugh.
Stay well.
Stay well. God bless you.